Hi, I'm Dimitrios Stefanidis, Vice Chair of Education for the department, and will present to you what is unique about the education culture of our program. The surgical training program at IU has developed an exceptional culture in education through the untiring efforts of its past chair, Gary Dunnington, and the dynamism of our current chair, Carl Bilimoria. Our education mission is to promote an effective, respectful, and innovative teaching environment for a diverse group of students, residents, fellows, and faculty. Here is how we achieve this mission. We monitor and assess our education culture on an ongoing basis, as is shown in this education dashboard, and make changes as necessary to keep driving it forward. We ensure our faculty have a passion for education during the hiring process. We provide special training to our faculty for how to be great teachers for our learners. Here you can see the agenda of our Surgical Educator series we are offering to our faculty on an annual basis. In my role as Vice Chair of Education, I regularly review the teaching evaluations of our faculty and share them with our faculty, including feedback when there is room for improvement. We use these evaluations to give teaching awards to our faculty annually. We have so many great teachers in this department that I am truly humbled every time I review their evaluations and have a really hard time who to pick for these awards. Our program provides our residents an unparalleled clinical training experience in a variety of hospital settings, taking care of a diverse patient population, as you heard in Dr. Choi's presentation, but we also offer you a state-of-the-art training experience. We have a structured proficiency-based skills curriculum for the development of basic and advanced surgical skills in open, laparoscopic, endoscopic, and robotic surgery, in a state-of-the-art simulation center that houses multiple simulators and is accredited by the American College of Surgeons. We further use animal and cadaveric models to increase the fidelity of training experiences our residents get. These are very popular. We offer resident Olympics that encourage healthy competition among our trainees. We emphasize professional development of our residents, offering them a structured residence as teachers curriculum, as well as leadership training for our more senior residents. The result is that we have multiple residents being recognized and awarded as excellent teachers by our medical school class, which is also a significant contributor to our clerkship being recognized as the best in the School of Medicine for numerous years. An important component of our education culture is the incessant efforts to innovate and be at the cutting edge of educational offerings to our trainees as well as educational research. We are not content with the status quo. We want to develop curricula that lead the way in surgical education and disseminate to other programs to adopt. There are multiple examples to reference here. We are developing a competence-based training model for our residency program. For those not very familiar with this type of training, it is a model that emphasizes the verification that a learner has achieved preset levels of performance rather than making the assumption that they have before they can advance to the next level. This paradigm matches learning objectives with relevant assessments and assures appropriate skill acquisition, is tailored to individual trainee needs, and minimizes performance variability at the end of training. Along those lines, we have developed innovative skills curricula that help you accelerate skill acquisition in procedures such as laparoscopic cholecystectomy, and we are currently expanding this to other procedures. We have previously shown that such curricula promote uniform skill acquisition, as you can see in the graph. We're offering our trainees an innovative state-of-the-art mental skills curriculum that helps you develop cognitive strategies to control stress and performance anxiety and optimize your performance in surgery. Such strategies include mental imagery, goal setting, attention management, and other techniques. This curriculum received an Innovation Award by the Association for Surgical Education. In partnership with our AMPATH program at Moi University in Kenya, we have developed a low-cost simulator that can be used for training in open appendectomy in low-income countries and beyond. Finally, the work Dr. Billy Moira has done, such as the first trial, has helped shape national policies regarding resident work hours, and the currently ongoing second trial is leveraging quality improvement approaches to reduce physician burnout and mistreatment. These and other innovations can only happen through the work of a dedicated team that focuses on state-of-the-art education research. This is the IU RISE team that has the reputation for being one of the best education research training programs in the country. IU RISE has had 10 research fellows since its inception, of which almost all have been from our residency program. Our fellowship is accredited by the American College of Surgeons. As our resident, you will have the opportunity to join this team if you have an interest in education research. I would like to close by highlighting the leadership our department has provided to surgical education nationally. Our past chair, Gary Dunnington, has been a world-renowned surgeon educator and past president of the Association for Surgical Education. He is credited for the development of the BID method for intraoperative teaching that is used widely in surgery and was instrumental in starting Simple, the skill evaluation app that is used across numerous US residency programs. Our current chair, Dr. Billy Moria, is a renowned health services researcher and past president of the Association of Academic Surgeons. He is leading the Indiana University Surgical Outcomes and Quality Improvement Center, SOCIC, and numerous efforts to impact national policy in the area of resident and faculty wellness with a number of trials. Our program director, Dr. Matt Ritter, is doing important work in video-based technical performance assessment for the Society of American Gastrointestinal Endoscopic Surgeons, SAGES, who is behind the development of the Fundamentals for Laparoscopic Surgery, FLS, that most of you are probably familiar with. Our past residency program director and current designated institutional official, DIO, Dr. Jennifer Choi, is president-elect of the Association of Program Directors in Surgery that oversees residency training in this country. Our Director of Education and prior residency coordinator, Brianne Nickel, is immediate past president of the Association for Residency Administrators in Surgery. And finally, myself, I'm immediate past president of the Association for Surgical Education, editor-in-chief of the Global Surgical Education Journal, and a member of the ACS Academy of Master Surgeon Educators. Now, you may have a better understanding why the education culture at IU is so unique. We look forward to meeting you and have you join this exceptional education team.